It was difficult for me to have a full-time job and maintain my own home and maintain my dad's and know that he was safe. So it was difficult. It was difficult. It was tiring and it was frustrating at times, but there's several of the people in Larimer County that are very intelligent, very helpful, and assisted me a lot.
Of all the things that Larimer County does, one of our biggest jobs is meeting the health and human services needs of our citizens. That means we do many things you take for granted, like inspecting restaurants, monitoring air and water quality, and things you don't expect to need, like emergency food assistance and help getting child support. Almost 1/5 of the county's annual budget is spent providing these services. Federal and state law mandates many of the programs. In fact, 75% of the funding comes from federal and state government. That leaves 1/4 to be paid by county residents as part of your property taxes. If you own a $240,000 home in Larimer County, you pay $1,670 a year in property taxes. $1,255 of that, about 75%, goes to support schools, city services, and special districts. $415 go to the county, and $77 of that go to support health and human services. So what do you get for your money? The Larimer County Health and Human Services mission is to prevent and relieve suffering and to promote human potential. That's a pretty broad challenge. Larimer County tackles this task through the services offered by the departments that make up Health and Human Services. They are Environmental and Community Health Services, Human Services, the Workforce Center, Community Corrections, and Cooperative Extension. Within these departments are many programs protecting children, preventing communicable disease, teaching life skills, assisting families, and much, much more. So, if you need to find a job, learn about infant nutrition or pollution prevention, we can help. And if you know a child in trouble, we're the people to call.
He was 16 years old, just turned 16 a couple days before, and really, really angry.
Liz Todd is an artist and a single parent who was having trouble with her son several years ago. On a tight budget and needing help, she didn't know where to turn.
Finally, at the recommendation of a friend of mine, when it got worse, I called the cops. It was the hardest call I made. Really. I mean, as I'm dialing 3 numbers, years just went through my head. It was the hardest call I've ever had to make. I had 2 women who showed up. They were wonderful. One went out, talked to Chris, one talked to me. And after they left, I couldn't remember. I mean, it was acronym city. It was like this alphabet soup. They were giving me names and acronyms, and I had no clue what to do.
Eventually, Liz did get help, and she and her son were able to get back on track. That experience led Liz to help design the Hub in 1995.
Not too long after I'd been through that, I received a call saying that they were putting together a design team for something brand new in the community, which eventually became the Hub. We really needed one place that was a single point of entry for all kinds of problems with kids, whether it be problems with law, beyond control with their parents, child protective cases where they've been abused. We needed one place where anyone can call and get help.
The Hub is only one way the county makes getting help easier.
One of the biggest challenges of taking federal and state programs that are designed by legislators or state or federal staff, but we're the ones who have to implement them on the local level, is the fragmentation of those programs. There are very few people who actually fit the mold, falling clearly and cleanly into one program or another. So what we work to do is bring together all of those different programs by assessing what a person's need is and basically going out and pulling in the program that they most need. And it may be 5 or 6 different programs. Many people are only one paycheck away from a crisis. And if they lost their job, they were injured perhaps and unable to work, may put them in a situation where they're going to need some of our services.
That's exactly what happened to Jeanette's family. Jeanette's husband earned enough as a painter for her to stay home with the kids. But when he suffered a serious injury that kept him from working, they found themselves homeless within 2 months.
It devastated me because I was used to being home and I hadn't worked in so long.
The county helped Jeanette's family get temporary assistance for needy families, or TANF. Under welfare guidelines, you must be involved in a work activity within 2 years of going on welfare. So, with her husband permanently disabled, Jeanette went to the Workforce Center to retrain for a job.
Normally we have several interviews to discuss everything about the person, all the aspects, and where they want to go, what they want to do, and discuss what we can do for them, and how we can help them achieve their goals.
They teach you that you are good enough. You can learn just as easy as someone else. If you put your mind to it, you can do it. Okay. And they just turned my whole life around. Now I'm a secretary one and do them really well.
I think our welfare programs are exemplary. We put together many different pieces that have offered a lot of support to the individuals. We have a car donation program for welfare recipients. We've probably given away 75 cars. Having mental health workers on staff has been pretty innovative, and that's proven very successful. Our job retention program, I think, has provided a valuable service.
I love it. I love it. I did work experience for about a year, which I came in every day and worked. But now it feels good to know I'm going to get that paycheck,
Whether you need to find a job, like Jeanette, or want to look for a better job than the one you have, the Larimer County Workforce Center is a valuable resource.
We offer workshops primarily to help people in their search for new employment. So some of it is maybe readjusting the skills they already have to a different type of job. We help them with identifying some training that they may need. We do workshops on interviewing, resume writing, how to use the internet to job search. We work with the general population who's seeking employment. We work with employers, and then we have services for what we call targeted populations, and those are individuals that have special needs or barriers to employment. And what we do with these targeted individuals or people with special needs is help them identify what's keeping them from employment. Is it they lack the skills they need for today's job market? Is it transportation? What are the pieces that are keeping them from obtaining and keeping their jobs? And then we work with them to remove those barriers so that they can become employable.
Education is an important part of what we do. Whether it's training for a better job or information on parenting, we give you tools that can help. Sometimes education can assist people in restructuring their lives. The Community Corrections Program helps people in trouble with the law get their lives back on track.
The program is a sentencing option for the courts where somebody needs a structured environment and maybe more than what probation can offer, but they're not a threat to the community, so they're able to stay in the community, maintain employment, maintain family ties and their support groups, pay fines, court costs, and restitution to victims, basically maintain themselves in the community.
Probably the best thing that ever happened to me. I always could drink, I always could drink, I always could smoke pot, and I haven't done that in several years now. So, I think the more away from it, I actually like it.
It's made me more responsible, I know that, because I'm 31 years old and I've been living with my mom, my relatives, here and there, friends, and I had a drinking and substance problem also, and it's just turned my life completely around.
At first I thought, this is the worst thing that could ever happen to me. I have to stop living my life. And now I realize that it's the best thing that could have ever happened to me, and now I'm going to really start living a good, clean life.
The health of the community is a high priority for Larimer County and our citizens. Many people live here because of the beauty of the area and the healthy lifestyle it affords. Keeping Larimer County a healthy place is more complicated than one might think.
Public health tends to be somewhat invisible because when we're doing our job right, nothing happens. It's usually easier and less expensive and causes less pain and suffering if you can prevent a problem than to try to fix it after it's occurred. So that's really where our focus is looking at what are the causes of disease, what are the determinants of disease, and how can the services of our agency impact the things that lead to those diseases in the first place. Sometimes it's by serving a patient in a clinic, like immunizing a child or treating someone with a communicable disease. Sometimes it's educating the public or advocating for policies that protect health, such as encouraging people to wear seat belts. Sometimes it's to protect the environment and sources of disease exposure in the environment, such as contaminated food or polluted water or dirty air. At the beginning of this century, the year 2000, life expectancy is about 30 years longer than it was at the beginning of the 1900s. About 25 years of those are due to public health interventions, and only 5 of those years are due to medical care.
My wife developed lung cancer in both lungs and had a lot of pain with it. I kept her at home except for the last 3 weeks that she lived. I was there 4 days out of 5 there at the last. And I really appreciated the help because I was worn out. You know, it's about as rough of things I ever went through. I just can't thank the county enough for all the help they gave me.
Our programs provide a range of services not only to the aging person who may be at risk in their own home or may need assistance brought into their home so that they can stay in their home, but also to the relatives and friends and caretakers of that person.
She died May the 6th a year ago, and I stayed at the house 13 months by myself.
My dad's health had deteriorated. He was in and out of the hospital numerous times, lots of emergency room visits in the middle of the night. I needed help. I needed it then. I have a full-time job, and we were in a very critical situation, and time was of essence. She would call me at my job and let me know what was going on, where we stood, what the timetable was so that I could plan for it. Because I could not move my dad into an assisted living facility without knowing whether or not we were going to qualify for Medicaid. And when you have a doctor telling you don't leave your parent at home alone and you have a full-time job, life goes on, but so do the bills. So you have to be practical about it. So they were very good.
Many of the programs we offer are mandated programs nationwide, and we as counties are the ones designated to provide them. So all of our programs are funded by a blend of state, federal, and county money.
You've just heard about some of the ways the community benefits from Larimer County Health and Human Services. If you own a $240,000 home, you pay the county $77 a year for all of these services. When catastrophe strikes, we're a safety net to catch you and help you get back on your feet. Beyond that, we do the day-to-day things that make your life a little safer, a little easier, and a little better. We're making Larimer County a healthier community.